Hello friends, today I am going to discuss with you another important topic, amniocentesis and chorionic villus sampling or CVS. There are a few questions come from this topic. Questions are rate of miscarriage with amniocentesis and chorionic villus sampling, adverse gestation, amniocentesis and CVS done. What are the risks associated with earlier amniocentesis and CVS? RH immunization after amniocentesis and CVS. Indications for amniocentesis and CVS. The points in this lecture has been taken from Green Top Guideline on amniocentesis and CVS. Pregnant women are offered amniocentesis or CVS for prenatal diagnosis for a variety of reasons, including a higher chance aneuploidy. Aneuploidy is abnormal number of chromosomes in haploid set. Screening result or fetal structure anomaly, a known risk of inherited genetic disease. With increasing use of cell-free fetal DNA tests, there is significant decline in screen-positive results, so fewer invasive prenatal tests are being carried out. However, both CVS and amniocentesis remain at present the only definitive diagnostic test for aneuploidy in pregnancy. The main aneuploidies which are detected are trisomies 13, 18 and 21 and also monosomy. Now amniocentesis, the risk of miscarriage is below 5.5%. The risk of miscarriage for twin pregnancy is 1%. It should not be performed prior to 15 weeks. Early amniocentesis, there is increased risk of talipes equinovarus. Talipes equinovarus, also known as clubfoot, in which the foot points downward and inward. Amniocentesis performed to obtain amniotic fluid for analysis is usually offered from 15 weeks. Third trimester amniocentesis may be offered for newly identified fetal structural anomalies, suspected fetal infection, fetal growth restriction. The risk associated with third trimester diagnostic amniocentesis are preterm labor 3 to 4% before 34 weeks and 4 to 8% before 37 weeks if performed. Overall, there is a 10% risk of culture failure for third trimester amniocentesis, but risk is higher for advancing gestation. Chorionic villus sampling, risk of miscarriage below 0.5%, same as amniocentesis. Risk of miscarriage for twin pregnancy 1%, same as amniocentesis. Should not be performed prior to 10 weeks to reduce the risk of technical challenges and also possible association with oromandibular and limb defects. CVS should be performed from 11 weeks gestation onwards. CVS carried out to obtain placental villi for analysis is usually performed between 11 and 13 plus 6 weeks of gestation. If required, CVS can be performed between 14 to 14 plus 6 weeks gestation. Individualized counseling of the merits of CVS versus amniocentesis should be provided for women considering CVS during this time period. The risk of miscarriage may be higher for amniocentesis and CVS with less skilled operators, units carrying out fewer procedures like less than 20 annually. Fetus has a chromosomal, genetic or structural abnormality. Now the risk associated with amniocentesis and CVS. Second sampling or repeat procedure, blood stained sample, confined placental mosaicism. Placental mosaicism is basically in which fetus chromosomes are normal, but there is abnormality in placental chromosomes. Maternal cell contamination, rapid test failure, failed cell culture, severe infection, fetal injury, or maternal visceral injury. Now, informed written consent is advised prior to either procedure. Women considering amniocentesis or CVS should receive detailed counseling and pregnancy mapping by suitably trained healthcare professionals. Women with multiple pregnancies and a confirmed diagnosis of anomaly from amniocentesis or CVS should be provided with information and supported in a non-directive way, including referral to specialist counseling services if required. Screening results for blood-borne viruses. Blood-borne viruses are hepatitis B, C, and HIV. Viral load and antigen test results should be reviewed when an invasive test is considered, and individualized risk of viral transmission should be discussed. Where screening results for blood-borne viruses are not known, testing should be delayed until HIV status can be determined, because there is increased chance of mother to child transmission if the patient has HIV has and is not on antiretroviral therapy. If amniotic fluid appears cloudy or purulent, or there are clinical features of intra-amniotic infection, consider microbial analysis and antibiotic treatment. Women should receive information on aftercare, including where appropriate, the need for prophylactic anti-D in non-sensitized rhesus negative women, and indication to seek medical advice following the procedure. Thanks for watching.